Hello, I am Dr. Dinesh Sharma, and today we will discuss about Ayurvedic viewpoint in the management of glaucoma. Glaucoma is a disease of optic nerves, basically. Optic nerves of eyes, which carry impulses of light from retina to the deeper tissues of brain to the target site of visual center of brain, and then a revert message comes and we see the object. This is how the physiology of vision takes place. So optic nerves in this disease, they become weak, the blood circulation in those optic nerves, it is reduced, and as a result the electric impulse becomes weak, and as a resultant the message which is coming from the brain, it also gets weakened. As a result, the patient loses his vision, sharpness in the vision very gradually. So the basic cause of this weakness of optic nerves is increased intraocular pressure. The eye works like a balloon, and there is a minimum turgidity in the eyes. The pressure, minimum intraocular pressure has to be there, otherwise the eye will shrink like a balloon if the minimum pressure is not there. If this pressure increases above its limit, then it bulges out. The eye becomes swollen, a type of swollen, and it creates a negative pressure over the optic nerves, and the blood circulation in those optic nerves, it is reduced, and finally the electric impulse going to the brain. So the basic cause of this glaucoma, there are multiple factors to stimulate this disease. The major causative factors are stress, use of smoking, non-vegetarian food, sometimes in some of the cases it is seen, and excessive use of alcohol, late night sleep, and if a patient gets up late in the morning after sunrise, if a patient gets up. So this is basically a lifestyle disease in majority of the cases. In some of the cases there are some other causative factors also. As a resultant, the optic nerves are getting weak. The initial symptom that a patient feels in the case of glaucoma is pain in the eyes and inability to face bright light. We call it in our scientific language as photophobia, difficulty to face bright light, and the eyes become red and swollen, and there is a very gradual loss of vision also. Sometimes in some of the cases, if this intraocular pressure rate increases sharply, all of a sudden if it increases, so there is a very acute stage of glaucoma, and in that particular condition there can be a downfall in vision very sharply also. So if that type of condition is there with the patient, one has to consult the ophthalmologist immediately without losing even every minute is important in that particular case, so the patient otherwise will become blind, because optic nerve is such a tissue which once degenerated, it becomes very difficult to restore its strength. So one has to consult ophthalmologist if there is acute rise in intraocular pressure, acute pain in the eyes, likewise we see it. And in some of the chronic cases, the pressure is increased up to a minimum level. That is a different type of glaucoma which increases very gradually. The vision loss is very gradually. In Ayurvedic viewpoint, in conventional systems of medicine, there are medicines that can lower the increased pressure. So that is a very safe thing. We have to restore the intraocular pressure finally. But there are no remedies in conventional system which can give strength to optic nerves also. In Ayurvedic viewpoint, how we treat this disease is very important to understand. Again, the game is of these three factors, these three physiological factors: Vata, Pitta and Kapha. Air, fire, and this kapha, lubricating material. These three factors contribute to the whole physiology of every system of body. In eyes also, there are three types of glaucomas we divided: Vata, Pitta and Kapha. If it is a Vata one, we need to identify it by study of that particular patient. If it is increased Vata dosh, if it is increased air factor, we have to nullify that particular condition. If it is increased Pitta factor, we have the treatment varies accordingly, and if it is increased Kapha factor, the treatment again changes according to the dosh of the patient. In Ayurveda, the target is, aim of the treatment is at 2 points. The first point is the same what the conventional systems of medicine are doing. The control of intraocular pressure. It is possible to control the intraocular pressure in chronic cases with the help of Ayurveda, without use of chemical medicines, without surgery. The second point, to restore the strength in optic nerves. As I told you that once there is a damage in the optic nerves, if it is completely atrophied, it is very difficult to restore its vision. But there are certain medicines in Ayurveda, certain procedures in Ayurveda that can give strength to the optic nerves up to a certain level, say 5%, 10%, 20%. In some cases even more, in some cases even somewhat less. But there are medicines that can give strength. So the line of treatment again varies as per the condition of this particular patient. In some cases with the use of some oral medicine, some kashaya medicine, some ghee formulations, some powders. There are multiple combinations in Ayurveda for the treatment of glaucoma that patient can use at home, and the pressure will be maintained, and this what we say optic nerve is gradually rejuvenated slowly if it is an initial stage. In complicated cases in which there is a severe vision loss, again patient has to come to the hospital, get admitted for 15-20 days at least, and there are Shirodhara procedures, Prakradhara, Nasya we do in these cases. Viration is a very important procedure, and then Netra Tarpan is done, Kirisvedam is done. A couple of procedures are designed as per the condition of this patient. They are customized as per the dosh of the disease, and they are done. And again, the patient has to continue medicines for sometimes 6 months, sometimes a year or more. But optic nerves can be strengthened. A patient of glaucoma has to see some of the points by which the vision loss can increase, by which the damage in the vision can increase at a high speed. They are avoid stress. This is the most important factor which increases intraocular pressure, which increases weakness in the optic nerves. The second point, avoid bright light, because as this increased pressure creates some photophobia, and our job is of such type that if we work on the computer for hours and we are a patient of glaucoma, then definitely it is going to be very bad for our eyes. The eyes will, condition of eyes will worsen with passage of time. Take a mind on your stomach, on your balls. The stomach has to be clean, the balls has to be clean in the morning. Do yoga, do meditation, and avoid junk food. One has to adopt a 360-degree approach for the cure of glaucoma. With Ayurveda and with modification of lifestyle, it is definitely possible to prevent from getting blind from this deadly disease called as glaucoma. Thank you very much. Hello, I am Dr. Dinesh Sharma, and today we will discuss about Ayurvedic viewpoint in the management of glaucoma. Glaucoma is a disease of optic nerves basically. The optic nerves of eyes, which carry impulses of light from retina to the deeper tissues of brain to the target site of visual center of brain, and then a revert message comes and we see the object. This is how the physiology of vision takes place. So optic nerves in this disease, they become weak, the blood circulation in those optic nerves, it is reduced, and as a result the electric impulse becomes weak, and as a result the message which is coming from the brain, it also gets weakened. As a result, finally, the patient loses his vision, sharpness in the vision very gradually. So the basic cause of this weakness of optic nerves is increased intraocular pressure. The eye works like a balloon, and there is a minimum turgidity in the eyes. The pressure, minimum intraocular pressure has to be there, otherwise the eye will shrink like a balloon if the minimum pressure is not there. If this pressure increases above its limit, then it bulges out. The eye becomes swollen, a type of swollen, and it creates a negative pressure over the optic nerves, and the blood circulation in those optic nerves, it is reduced, and finally the electric impulse going to the brain. So the basic cause of this glaucoma, there are multiple factors to stimulate this disease. The main causative factors are stress, use of smoking, non-vegetarian food, sometimes in some of the cases it is seen, and excessive use of alcohol, late night sleep, and if a patient gets up late in the morning after sunrise, if a patient gets up. So this is basically a lifestyle disease in majority of the cases. In some of the cases there are some other causative factors also. As a resultant, the optic nerves are getting weak. The initial symptom that a patient feels in the case of glaucoma is pain in the eyes and inability to face bright light. We call it in our scientific language as photophobia, difficulty to face bright light, and the eye become red and swollen, and there is a very gradual loss of vision also. Sometimes in some of the cases, if this intraocular pressure rate increases sharply, all of a sudden if it increases, so that is a very acute stage of glaucoma, and in that particular condition there can be a downfall in vision very sharply also. So if that type of condition is there with the patient, one has to consult the ophthalmologist immediately without losing even every minute is important in that particular case, so the patient otherwise will become blind, because optic nerve is such a tissue which once degenerated, it becomes very difficult to restore its strength. So one has to consult ophthalmologist if there is acute rise in intraocular pressure, acute pain in the eyes, likewise we see it. And in some of the chronic cases, the pressure is increased up to a minimum level. That is a different type of glaucoma which increases very gradually. The vision loss is very gradually. In allopathic viewpoint, in conventional systems of medicine, there are medicines that can lower the increased pressure. So that is a very safe thing. We have to restore the intraocular pressure finally. But there are no remedies in conventional system which can give strength to optic nerves also. In Ayurvedic viewpoint, how we see, how we treat this disease is very important to understand. Again, the game is of these three factors, these three physiological factors: Vata, Pitta and Kapha. Air, fire and this Kapha, lubricating material. These three factors contribute to the whole physiology of every system of body. In eyes also, there are three types of glaucoma we divided: Vata, Pitta and Kapha. If it is a Vata one, we need to identify it by study of that particular patient. If it is increased Vata dosh, if it is increased air factor, we have to nullify that particular condition. If it is increased Pitta factor, we have the treatment varies accordingly, and if it is increased Kapha factor, the treatment again changes according to the dosh of the patient. In Ayurveda, the aim of the treatment is at 2 points. The first point is the same what the conventional systems of medicine are doing. The control of intraocular pressure. It is possible to control the intraocular pressure in chronic cases with the help of Ayurveda, without use of chemical medicines, without surgery. The second point, to restore the strength in optic nerves. As I told you that once there is a damage in the optic nerves, if it is completely atrophied, it is very difficult to restore its vision. But there are certain medicines in Ayurveda, certain procedures in Ayurveda that will give strength to the optic nerves up to a certain level, say 5%, 10%, 20%. In some cases even more, in some cases even somewhat less. But there are medicines that can give strength. So the line of treatment again varies as per the condition of this particular patient. In some cases with the use of some oral medicine, some kashaya medicine, some ghee formulations, some powders. There are multiple combinations in Ayurveda for the treatment of glaucoma that patient can use at home, and the pressure will be maintained, and this what we say optic nerve is gradually rejuvenated slowly if it is an initial stage. In complicated cases in which there is a severe vision loss, again patient has to come to the hospital, get admitted for 15-20 days at least, and there are Shirodhara procedures, Takradhara, Nasya we do in these cases. Viration is a very important procedure, and then Netra Tarpan is done, Kirisvedam is done. A couple of procedures are designed as per the condition of this patient. They are customized as per the dose of the disease, and they are done. And again, a patient has to continue medicine for sometimes 6 months, sometimes a year or more. But optic nerves can be strengthened. A patient of glaucoma has to see some of the points by which the vision loss can increase, by which the damage in the vision can increase at a high speed. They are avoid stress. This is the most important factor which increases intraocular pressure, which increases weakness in the optic nerves. The second point, avoid bright light, because as this increased pressure creates some photophobia, and our job is of such type that if we work on the computer for hours and we are a patient of glaucoma, then definitely it is going to be very bad for our eyes. The eyes will, condition of eyes will worsen with passage of time. Take a mind on your stomach, on your balls. The stomach has to be clean, the balls has to be clean in the morning. Do yoga, do meditation, and avoid junk food. One has to adopt a 360-degree approach for the cure of glaucoma. With Ayurveda and with modification of lifestyle, it is definitely possible to prevent from getting blind from this deadly disease called as glaucoma. Thank you very much.